Great. Again, this is Philip Levinson, VP of Marketing at EdCast. I'm joined by my colleague, Corey Thompson, Director of Enterprise Solutions.
Hey, everybody. Welcome.
And we have a number of distinguished guests and a jam-packed webinar. This is the future of work in healthcare, best practices in training, upskilling, communication in healthcare and pharma in 2019. And we are joined by a number of very smart and very well-connected folks from the industry. Let me first give a shout out to our good friends at Christus Health, represented by Tobias Washington. Tobias, are you there?
Hello, I am.
Fantastic. Proud to have you and Christus as a customer, and thanks for joining us. We also are joined by our friends at Viserys Communications, Rhonda Collins. Rhonda, are you there?
I am, Phil. Thank you.
Absolutely. Thanks for joining us. And finally, we have Chris Christensen from Syneos Health. Chris, are you there?
I'm here. Thank you. Welcome, everyone.
Absolutely. It's great to have the three of you, and Corey and I are looking forward to an information-packed webinar. This is really an important topic. The future of work in the healthcare and pharmaceutical industries is a topic a lot of us are focused on and talking about. We're going to go ahead and get things started with our first presenter. And with that, I am quite pleased to formally introduce Christus Health is not only an amazing healthcare organization, we're proud to have them as a customer here at EdCast. I know they're also a partner of Viserys. And with that, let me go ahead and introduce to you the Director of Experience, Design, and Technology, our good friend and our partner, Tobias Washington. Tobias, take it away.
Well, thank you so much, Phil. It's a pleasure to be with you guys. I'd like to share a little bit about our digital learning strategies, more importantly, our digital learning ecosystem that we've been working to build with our EdCast partner here at Christus Health. You can advance to the next slide. So we have a vision of what digital learning should look like at Christus, and that was based on a few guiding principles. The first was that content is everywhere. Our associates can find content anywhere, but typically our LMS has become a place that folks visit once a year or whenever they get a mandatory assignment. We wanted learning to be fresh and fun, and we wanted folks to fall in love with learning again. So that was the guiding principle. One of our guiding principles toward our digital learning ecosystem is that we would have a central place that you can not only find the content that's assigned to you, but you would also be able to find the content that is also advancing and upskilling you in your work. We wanted content to be video enabled. We know that most prefer to learn in short videos. Even from a social media perspective, I will tend to visit my Instagram more than my Facebook or anything like that or Twitter, because the Instagram is more picture and video-based content. So it allows us to consume it very quickly in small bite-sized chunks. And to follow that content is available from anywhere, accessible anytime, and accessible from any device. And we also wanted our response time to be sooner and get folks to work faster and more productive, and we could respond to content, be creating content more quickly, and that our content was more aligned to the business objectives of the organization. So it allows us to, we would want to make sure that we can pull in the content that's most applicable to those associates at the right time. So those are some of the guiding principles to our digital learning ecosystem. You can advance to the next slide. And so I love this slide because it puts me in the mindset of our Blockbuster Moment. I remember as a kid, I used to love to go to Blockbuster on Friday nights, and you would just walk in and see the wall-to-wall cases of videos, and that was the best experience for your mom or your dad to take you to Blockbuster on Friday night. Blockbuster didn't keep up with the times and keep up with the trends, and so this, in my opinion, is my learning and development are opportunities to seize our Blockbuster moment and not fall behind, but continue to work toward an experience that our employees and our associates would appreciate. Outside of work, our employees have a more Google, Netflix, Amazon type experience, and they tend to appreciate more mobile type of experiences, things that are easily accessible. Inside of work, we tend to keep things more archaic. You have to find things on some bookshelf, or you have to search for it. You have to know where to find the content. And so inside of work, we want to provide the same experience that they have external of work. We want to provide that easy Netflix experience, that easy Uber experience, that better experience that you receive from Amazon from a shopping perspective. And digital business has hit every industry, and it's now HR and learning and development's turn to provide that same consumer experience inside of our workplaces. So that's another one of our guiding principles to match that experience external to the workplace and to provide the associate or the employee that one seamless experience both inside and outside the workplace. You can advance to the next slide. Great. So some consideration for how we designed our modern learning ecosystem. Okay. One, we wanted that experience to go beyond the LMS. Typically, content was always siloed to an LMS type experience, and we know that most LMSs, not all, provide more of a less than modern experience. So we wanted our content and our experience to be greater than our LMS is today. We also challenged ourselves to think about things in digital first modality. So if it could not be done in a digital way or consumable in a digital medium, that would be something that would challenge us to rethink the way we were presenting that content, authoring that content. And then it is my opinion that sometimes it's going to be hard for us to find this one system that does everything. So we wanted to build an ecosystem that was flexible, something that you could build on and grow with. And so we adopted a standard language, the way our systems would connect, the way they would talk to each other, and that was through APIs. And so as we bring in new vendors and as we think about our partners, that was a huge part of us considering EdCast, is that if it couldn't connect to an API or if you didn't have APIs, that would kind of be a strong consideration of whether or not we would partner with you as a vendor or as a partner in our ecosystem. But we wanted to be strong on focus, and then we also wanted to make sure that we were heavy focused on this new language called XAPI, which helps us understand a little bit more about how our learners consume our content and also when and where and how they are taking our courses. Thank you. And we wanted to give our associates this one single place to consume content. Today, our associates, if we are subscribing to premium content, we usually bring in that premium content. We say, oh, we put it over here, and then we buy another premium content source, and we're like, it's over here, and then the associate has to figure out where to go and try to find that content. So part of our experience and part of our digital learning ecosystem is that it would provide this single place that you would go, any content that we bring in, any content that we purchase, your annual assignments, all of that content would be available via this one single source. And then, of course, once we stand up our ecosystem and once we provide this one single place, we could then begin to provide these hyper-personalized experiences. So the other thing that the Netflix or the Amazon type experiences give you is that when you log in, it says, hey, I recognize you, I know who you are, so I'm going to give you what's most relevant to you. Typically, our traditional learning platforms give you what only the administrator has assigned to you. Today, if you log into something like an EdCast, it says, hey, I know that you are a very technical person, and I know that you're working on Python as a goal, so I'm going to find those courses that have been rated highly and recommend those things to you. And so we also wanted to make sure that folks have a very clear path of get a very clear path of what's important to them, and then they also have recommended learning that's pathways to their targeted growth plans. Finally, we wanted to also start to reduce printed materials. We typically print a lot of books, and they were nice-sized books, and we would give these books out, and then folks would have a development need. But I tend to find that folks don't go back and find the book that we gave them. They typically go tap their neighbor or they email someone, and so we wanted to stop printing and go to more of a mobile learning strategy. And so that was also a huge part of us partnering with EdCast. That also helps us make sure that we can refresh content more easily when folks need to find their content. It's more readily accessible, right in their hands. And then, of course, if they are not trying to find paper or something like that, they can get to work sooner. And a huge part of that printing budget could be reinvested into other initiatives that you may have. So next slide. So this is just a real graphical image of how our ecosystem was built, or we're working to continue to build it. We wanted EdCast to be our learning experience platform and provide that front door, and that could be either through a mobile device or through your desktop computer. And to the left there, all of the content sources that we subscribe to or that we would future subscribe to would be accessed through EdCast. And today you would have to know where each of those content sources live and then find them, and then, of course, try to find the content that's relevant to you. So in our new experience, you would go to the one single place, you go to EdCast, and all of those content sources are available to you. And then more futuristically, we want to take data from our experience. Sorry, I'm not sure if that's me or not. Hello?
Yep. Tobias, I think that's you, but that's okay. Let's keep pushing through. I know you're in the middle of some good stuff there.
Okay. So we also wanted to leverage data from like our associate performance, our associate engagement, and their performance data to influence the content that they receive when they log into the learning experience platform. So more futuristically, we would take their talent review data, the recognition and engagement data, their performance data, and feed that back into the learning experience platform to give them a more personalized experience. We wanted to take the data from all of those systems and move them to what we call a learning record store. That way we would have a seamless, an aggregated platform in the background that's helping us capture the analytics from everything versus trying to go to each source and pull that data. And that's our ecosystem. One last thing I'll share with you, if you'll advance to the next slide, is that we have also adopted to reward our associates more digitally as well, in a way that they could recognize them, they could recognize their learnings more socially, and then, of course, they would have a way to capture those things in a more digital capacity as well. So we partnered with also with a company called Credly, and we're moving more toward to issuing digital badges for folks that are succeeding in learning programs and making strides in their accomplishments. And I'll ask you to advance to the next slide, and that's just an example of how if you click on the digital badge, it gives you an example of the program and the skills that they've gained and what it took for them to earn that badge. And finally, a part of our strategy, I apologize, has to be
That's okay.
To offer a more virtual experience as well. So we are also looking into virtual reality, and we're producing our first virtual reality experience for in our hospitals. Safety is a huge concern, so we are working on creating a virtual reality experience on how to de-escalate patients in our hospitals. So we're just exploring a lot of different things, a lot of ways to advance learning, to move more past the traditional job aids and handouts, and use a lot of those things to advance into the digital modern world and not be the next Blockbuster. Thank you for the time.
Absolutely. That's great, Tobias. I know there'll be a question or two at the end, which we will get to, but that's an amazing presentation. Thank you for sharing the context of what you and Christus are doing. That's a good segue to talking to Rhonda and what Viserys Communications has to say. In fact, let me pull up her presentation. I know Christus is also a partner with Viserys. Let me formally introduce to you our next presenter. Rhonda is the Chief Nursing Officer at Viserys Communications with extensive experience and background in the industry. I don't have all the time to walk through it all, but why don't I hand things over to Rhonda, and we'd love to hear about your focus on improving care and team communication in healthcare. Rhonda.
Thank you, Phil. I appreciate that so much. And thank you, everyone, for attending today. Just to give you a little bit of background about Viserys, I think at my elevator statement on Viserys is that we are a communication software company. Our purpose is to enable safe, targeted, effective communication, primarily in the healthcare market, although we are in industry, some in retail, some in nuclear sites. We do wherever you need targeted information that needs to happen right now, Viserys is there. We do that very, very well. Next slide, Phil. This is our mission. We simplify and improve the lives of healthcare professionals, patients, and families. I think overall our goal is to return clinicians to their purpose of providing safe, effective care in a chaotic and very complex setting. We are focused entirely on helping to eliminate the wear and tear on nurses and physicians as they work through caring for all of us and our family members. There's probably no one on this call that's going to get out of this life without being a patient or one of your family members being a patient. So we all will have an encounter with those nurses and physicians that provide the care for us, and we want them to be functioning as safely and effectively as possible, and we want our loved ones to have health care that is meaningful, that is, it's personal. Your caregivers are enabled at the bedside, and that takes me to my next statement is we allow them to do what they were trained to do. And Viserys basically carries the burden of memory in providing notifications for these clinical communication challenges. Some of us are very aware of this because we live in this space all the time, but there's 8.3 billion wasted annually in U.S. hospitals because of communication inefficiencies. You know, those of you who work with IT know about cyber criminals and the issues that go with that and the attacks on the healthcare verticals. Miscommunication is the result are behind 80% of serious medical errors in hospital. The Joint Commission has identified this for over 10 years now, and we have continued to work toward reducing those. These are miscommunications, absence of communication, wrong information, all of that is included in this bucket. Probably the most dangerous point of a patient's healthcare experience in the hospital is that transfer from either service to service, unit to unit, or inpatient to outpatient, et cetera. Those are where communication failures tend to occur predominantly. But 30% of malpractice claims, you can see, are attributed to ineffective communication. Tens of thousands of alarms and notifications go unrecognized or without clinical intervention. And as a nurse, I'm heavily focused on the cognitive burden of nurses having to field information. Clinicians do not have the ability to determine what kind of information, the frequency of the information, or the modality of the information that comes to them. So they continually have to deal with it all day long in every practice setting, in every way. And what Viserys does is try to carry that burden of memory and carry that burden of information so the clinicians then have the moment to segment and understand the information as needed to provide effective care. Next slide. So how do we do that? We look at real-time healthcare system and how is information managed through the healthcare system. We're all familiar with our EHRs, which is our documentation repository. It's essential to what we do in managing and storing the information. What Viserys does is the next step from documentation, which is right now communication, enabling caregivers to speak to each other inside a software eco-platform so there's the same nomenclature, there's the same approach, there's the same discipline, so there's not confusion on a device of choice. So if you look at this slide, you can see that we take everything from nurse call, EHR, patient monitors like cardiovascular monitors or physiologic monitors, IV infusion pumps with medical devices. We can put all of that through our intelligent rules engine that our customers can define and say, we consider this important, we consider this urgent. I used to always say when I was working in the hospital, I would say, every bit of information I get is important, but I live under the tyranny of the urgent. And I think that that is very unique in some ways to healthcare. And so what we try to do is only send forward actionable information. Important information can wait until a clinician can retrieve or view in the EHR or in another system. But when you need urgent information right now, that's where we are. Urgent labs, urgent notifications, urgent patient status notifications, and then urgent communications between physicians, nurses, and extended healthcare teams. So you can see it comes through on the far right-hand side, and that we can even send urgent information to folks like environmental services who manage our physical system that we work in. And sometimes when that physical system is not up to date, beds are not turned over or not available, it can definitely impact the patient experience and it can definitely impact patient outcomes. And so we try to ensure that the entire health care team has the proper data, alarms, text, alerts, and voice communication they need, all within the same platform of software. Next slide. So let's talk just a little bit more about cognitive load, the risks and impact. I spend a great deal of time talking about this in the fact that when clinicians have to use their own short-term memory or they have to store information, that they become overloaded. There is a certain element of PTSD that comes over time of every time you show up at work. Every single time you're engaged at work, you are managing massive amounts of information and communication that are not just for one person, or not just two, but increasing numbers of patients that you have to care for. To remember, oh, that lab value is abnormal. I've got to finish this task, and then I'm going to let Dr. So-and-so know. For us to be able to do that, we carry that memory. We can provide technology reminders to say, you need to go take another set of vital signs on this patient who's receiving blood. It's very important that you do that. So nurses have reminders about lab values, patient status reviews, medication management, those sort of things that we provide. It's all in the context of the patient. We can view care teams, so no one has to go look for a number. Nobody has to go figure out who's who and who's on call and all of those sort of things, because we provide all of that to reduce the potential for medical errors, to reduce the chaos, and to reduce the extreme risk for patient harm when the needed information is not available in the moment that it's needed. And as you well know, just the constant wear and tear of what I sometimes call gnats around the ankles, those things that just swarm you constantly when you're working in a very chaotic, very high-risk environment, can lead eventually to absolute fatigue and sometimes even burnout. Next slide. So another safety challenge that we see in hospitals really around the world is workplace violence. It's 4 times more likely to happen in hospitals than any other place of employment. So Viserys has really worked with our customers all around the world to determine what do you need to ensure effective communication in that split-second moment of attack or violence against a healthcare worker. Many times workers are in a room, in an emergency room with a patient, and the patient has them. They can't reach the emergency string to pull, or they can't reach the button on the wall, or they can't pull the phone out of their pocket because they're in a compromised position, and they have no ability to call for help, so their only option is to yell. What Vocera does with our hands-free communication device, the nurses just have to press a button. Any healthcare worker presses a button and it notifies. We have seen shortened response times in the ED from just over 3 minutes to just over a minute. And as you know, every second counts. Security response time for folks in a hospital, we've seen incidences reduced from an average of 2.5 minutes to respond to a healthcare worker calling for help to less than a minute. These are really important communication features that hospitals and clinicians need to feel safe in their environment. Next slide. The way we do this is with a Vocera wearable device called the Vocera Smart Badge. You can see the dedicated panic button is what we call it. It's the red button on the side of the badge. This is a small, lightweight, wearable device. All the nurse has to do is reach up, tap that button, and receive immediate care and backup. So as a review of where we are, Vocera is a communication company. We provide software that functions on iOS, Android, or our preferred and dedicated badge. And we're able to provide communication discipline and strategies and software configurations that are personalized to healthcare organizations all around the world in different languages, whatever we need to do to ensure that our healthcare providers have the tools that they need to do the best job they can, which all of us went to school and all of us were trained to take care of patients. And sometimes just the environment makes it difficult for us to spend time at the bedside. So we can remove the wear and tear, and we can return clinicians to their purpose of providing safe, effective care for patients. Thank you, Phil.
That's great. Thanks so much, Rhonda. It's really interesting to hear you talk about the tyranny of the urgent. Certainly anyone in the healthcare space understands that, and also the critical importance of communication in delivering both quality and improved and enhanced care in healthcare organizations. So thank you.
Sure. Thank
with
you.
that, absolutely. Let's do this. Let me pause and point out to all of the folks on the webinar that we will take Q&A at the end. You can enter your questions by going to the lower right-hand side of the WebEx screen, and you can type them in there. We will do our best to get to as many as possible. Again, we're going to keep pushing forward, and we're going to transition now to our third presenter. As you know, the name of this webinar is The Future of Work in Healthcare and Pharma. So to talk about what's going on in the pharmaceutical industry, we're very proud to have Christensen, who is the Director of Learning Technology and Innovation at Syneos Health. Chris.
Thank you very much for having me. For those of you who don't know Syneos Health, and perhaps you probably don't unless you're in the pharmaceutical and biopharmaceutical world, Syneos Health is a leading CRO, contract research organization, and our fundamental mission is to make sure that the pharmas and biotechs of the world have the contract resources they need to conduct their clinical studies, and then to staff up their field forces so that they can get not only the sales teams but any field force, any field-facing force out there into the marketplace as quickly as possible, armed with the best possible information they can to sell the best possible pharmaceuticals as they can. And so I work for a group within Syneos Health called Learning Solutions, and our mission is to ensure that the healthcare professionals, whether they be doctors, whether they be medical science liaisons, whether they be pharmaceutical representatives, get access to the best quality education and tools that facilitate education in the best possible ways. So if you wouldn't mind advancing to the next slide. And as already has been said, the world of learning technology is changing at a breakneck pace. It has changed more rapidly in the last 10 years than I think it has in the previous 20 years before that, and its pace is only increasing. And as the pace of learning technology changes, it's imperative that one finds trusted partners that one can work with in order to ensure that you stay up on top of things. How many of us are familiar with our situations of making a deep investment into a learning management system, spending the 2 to 3 years to get it configured properly and up and running, only to find out by the time you get to go live that it's already antiquated? Well, we don't have the luxury anymore. We have to stay on top of the game when it comes to learning technology in order to ensure that people get the best possible content that they can. As was already said, content is everywhere. So it's a matter of making sure that you provide the right kind of content to the people that you have responsibilities for, and to do it in the most effective manner possible. So having a trusted partner or a set of partners is imperative to make that happen. Next slide, please. At Syneos Health, we produce every year a trends report. And that trends report looks across the industry of pharmaceuticals and biopharmaceuticals and looks at what's going on and what will be the state of affairs within the industry in all aspects of the industry. Well, the group that I work with, called Learning Solutions, we focus on things related to learning. And what I'd like to do today is share with you 3 of the biggest trends that will be true of the second half of 2019 and beyond, and share with you some of our thoughts around why those are so important and why we need to pay attention to them. The first trend that I want to talk to you about is the business of launching drugs, launching pharmaceuticals into the marketplace. This will be the single biggest issue that will impact biopharmaceutical and pharmaceutical companies through the end of this year and into next year. As the healthcare world has changed, so too has the pharmaceutical world changed. Pharmaceutical companies are now faced with the realities of dealing with very highly specific targeted therapies that they go after. And in order to make an entree into the marketplace, you have to have very targeted, very specific, and very bold initiatives with your interventions in order to make a splash, in order to be seen. And so trend number 1 that we've been watching in the industry is the need for bold launches of new medications. It will be the number 1 imperative. And if you go to the second slide, please, or the next slide, please. What it implies is that we have to prepare our field teams, whether they be the science and other service field teams or whether they be the sales field teams. We have to prepare them to be as bold as the launches are that we're asking them to represent. As doctors, as healthcare professionals, as patients are flooded with medical information, more and more people are becoming educated in a very complex marketplace, which can oftentimes lead to confusion and frustration. And with new regulations and new players coming into the market, it's not business as usual anymore. With the new health economics, everything gets measured and everything is being evaluated. Everything from your visit to the doctor's office to your trip to the pharmacy, everything has metrics associated with it, and everything is being evaluated. Because that's so, we have to stay on top of those changes that are going on in the industry, and the primary interface with that world happens to be the training function of most pharmaceutical and biopharmaceutical companies. Trainers indeed have a huge responsibility within these organizations. And so it's our position that in order for training professionals in the pharma space to be effective, they have to focus on three things in order to stay current. Number one is moving into the multimodal. There needs to be a mix of technologies, a mix of things to allow for not only the way in which learning is delivered digitally, but also that content is delivered in a very personalized or adaptive way. So as Tobias mentioned, we want to have experiences with our learning that's very much like Amazon. When our learners come to whatever our learning ecosystem is, we want that ecosystem to be smart enough to know who we are, what we've done in the past, what we need to do in the future, as well as the things that we might be interested in based upon our habits and upon our needs. And so when training professionals can think truly in a multimodal world, they become far more effective. The next one is extending learning. Once we've identified multimodal opportunities, it's now time to include the right mix that personalizes everything to the individual and to push training out as much as it is to pull training down. We're all familiar with push training whenever we log into our LMS. Well, those days are going to stay with us. However, coming up quickly behind them is an era of pull mentality where people go to learning platforms to get the content they want, not just what some administrator thinks is important. And so finally, we want to make sure that training professionals focus on goals. If learners go out and can find any content they want, anytime they want, anywhere they want, it's imperative that training professionals tune into, understand, and go after the goals of the learners and build their plans accordingly. So to the extent to which training professionals can then identify the electronic tools and the content that they need, they can then focus on the things that matter most to their learners and get into their hands the things they care about the most. Next slide, please. The second major trend we are seeing in the pharmaceutical space is the business of empowering field teams. When teams leave pharmaceutical companies and go out and try to sell pharmaceutical products, their role has been changing just as much as the physician's role has been changing. If you've gone to your doctor anytime recently, chances are you found out that your doctor is no longer in a private practice anymore, but is part of a much larger network of doctors, a system, if you will. And so doctors are effectively becoming employees of a large system more than they are private practitioners anymore. And because they are becoming employees, metrics are everything. And so everything from formularies to algorithms that drive care, doctors and other healthcare professionals are being monitored now more than ever. So our field teams must be empowered to react accordingly. So the field team, its primary mission still remains the same, which is to provide clinical differentiation between what they are selling and what else is available in the market. But nowadays, no sales representative is flying solo. Every sales representative, every field representative is part of a unit or a team, and that team brings power, the power of collaboration, the power of being able to deal with complexity, the power to bring quicker responses to industry changes. And what that does is it increases our need for sophistication around data and around our ability to navigate with technology. And what it requires then is a sound set of instructional design philosophies and perspectives and the resources to pull it off. So now we can truly align healthcare professionals, patients, and the providers or the purveyors of pharmaceuticals with the sophistication and the tools they need in order to ultimately be successful in the treatment and care of patients. Next slide, please. In order to make it all happen, we need to understand the nature of the new business of medicine. As we said, healthcare is changing. We need to increase that sophistication. We need to make sure that we have people empowered with the right tools. And as has already been made mention, we want to make sure that the information we're providing people is in the digestible size chunks, bite-sized bits that are consumable on demand from any device, anytime, anywhere. And so if we can do this, we can truly empower our field teams to be as efficient and effective as possible. Next slide, please. The third major trend that we have been seeing in this environment is the fact that the job market is also changing. Talent development is now a big issue, and our top performers are now open to look for new opportunities wherever they may happen to be, wherever there's a better culture, a better pay, better opportunities for promotion, or what have you. Our top talent is always at risk of fleeing from our organization to somebody else's. One of the key differentiators that will help an organization to stay competitive in the talent market is whether or not they have access to quality talent development and educational products. So next slide, please. So what an organization then needs to do is focus on creating a culture of learning, where that culture allows and enables its employees, primarily, of course, our highest performing individuals, to access the learning when they want to. These days, learners who are of top talent will go and be responsible for their own development and won't wait for organizations to push down to them. They go out and find their stuff. And they go to apply their new knowledge with new skills on the job. But just as we've already talked about, that content can be available anywhere. So what's needed is curated content by the organization, so that people don't go searching YouTube for the latest and greatest information on something. They go to authoritative sources of knowledge to get the information that they're after. And then finally, focus on the ongoing and dynamic strategies that allow for organizations to be effective. You've got to focus on goals. You've got to focus on strategy in your marketplace. And you've got to make sure that whatever you do, it's metrics driven, so that you can demonstrate that you are being as effective or more effective than what your goals are suggesting. So with that, I'll conclude. So you can go to the last slide, please. If you want to have access to our trends reports that we publish every year, please feel free to contact me. More than happy to share with you whatever we've got that would help improve your learning environments.
Great. Thank you so much, Chris. And we appreciate the overview. Very interesting to hear about the shift to multimodal, as well as the importance of creating a culture of learning. I think that's definitely a theme here in this particular discussion. With that, we are going to keep things moving. We are going to talk a little bit about EdCast, and then we're going to take questions. We should have time for about 5 or 6 minutes of questions at the end. Again, thanks so much, Chris. For EdCast, I will kick things off and talk a little bit about how EdCast partners with healthcare organizations, whether it's Christus Health, and we heard from Tobias earlier talk about several of the themes that we might repeat a little bit here, or whether it's Jefferson Health or any of our other healthcare organizations. There's a few key themes that come up, a few important patterns in what we see, and we'll talk a little bit about what that means for the future of work in healthcare. So first, there's several very important future of work challenges. I know Rhonda actually did an amazing job of emphasizing some of these. She alluded to some of the challenging cultural aspects in working in a healthcare organization, whether you're a nurse or a doctor or an administrator. We talked a little bit with Tobias about the importance of keeping employees satisfied, about how training has the potential to be complex and the need to make it easy or easier and simpler. We also talked about lack of measurability. I know, Chris, you said metrics are everything. We agree, and that measurability is important, especially in an industry so focused on compliance like healthcare. Turnover is really important, and I know, Rhonda, given your experience in nursing, turnover is really important because as that turnover number goes higher, it creates stress on both the outgoing, how to transition knowledge and expertise from one person that's leaving to another, but also the incoming, those new team members that now need to be trained and understand how each particular member of their team works. We also know that training and HR are really critical in healthcare, and that predictability, like Rhonda said, living under the tyranny of the urgent, that predictability is sometimes lacking. So these are some of the challenges that we're seeing in future of work, and at the same time you want to maintain a great patient experience. So all this represents a significant challenge. So at EdCast, what does the future of work in healthcare look like to us? Well, first of all, an easy answer is to say everything that Tobias said, because he echoed a lot of the themes that we like to emphasize. But a shorter answer, and maybe more in summarizing it in one sentence, is everything that Tobias talked about in terms of goals will be part of the process, plus healthcare organizations will find ways to be more efficient, trying to do more with less, but still placing an increasing emphasis on security and compliance. And again, we heard from Rhonda on how important security is in 2019 and beyond. So let's get specific. What are the three key challenges we see from a talent point of view? First, clearly hiring and onboarding. Not only the time to fill certain roles, but who are we bringing in and how long does it take to get them to maximum productivity. Second, engagement and retention. And we talked about turnover, but the employee experience. How do you optimize the employee experience, which in turn results in improved quality, as well as lowered turnover and lowered stress and increased predictability. And finally, compliance and ongoing training. It's one thing to say you want to continue to train and educate your organization, but you need to do it in a compliant way, again, living under the tyranny of the urgent, like Rhonda suggested. So there's always a balance. How do we stay compliant, but still maintain the need for communications and updated training? So with that, let me suggest, and by the way, we've seen that organizations in healthcare that have done well with their talent management have experienced strong results. Again, Chris talked about metrics. Well, we've seen over 20% higher employee productivity. We've seen higher HCA, HPS scores. We've seen more than 20% higher retention. Plus, almost 40% are more likely to report having qualified leadership candidates when they want to promote from within. So all these are benefits if we can solve and address these issues. So how do we do that here at EdCast? I know Tobias did a great job of summarizing that. And let me, there we go. So let's quickly, and then I'll transition to Corey, let's quickly talk about Nurse Sally. So she's at a healthcare organization, whether it's Christus Health or Jefferson Health or any number of the hundreds and hundreds of healthcare organizations that we talk to, there's some common challenges. First of all, Tobias, as he alluded on the left-hand side, there's all this content that she's trying to absorb. They have their own systems, whether they use IBM or Box or Microsoft. They may have an LMS, whether it's SuccessFactors or Saba or Cornerstone or more healthcare-focused LMSs like HealthStream or NetLearning. Also has premium content. Let's say the organization partners with Elsevier or with Davis's Drug Guide as an input on before prescribing certain medications. New England Journal of Medicine. There's a whole series of paid healthcare content, and there's also some free and open content. Finally, there's patient management systems that sometimes nurses and doctors and administrators need to pull from. Well, how does she do that when, if you look on the right-hand side, she is living and breathing on a daily basis in these types of places? For example, she could be on her mobile device with her Viserys collaboration suite. She could be in Epic, Cerner, Allscripts, or any number of other EHR partners, Athena Health or McKesson. Again, there's dozens. She could be living and breathing in Workday or in ServiceNow or in the Salesforce Health Cloud. What she needs is a unified way to both discover and access this content and do it in a measurable way. So this is where EdCast comes in, and you can see that the EdCast Knowledge Cloud helps bridge the gap, and it helps allow her to have access to all this content on the left while living and breathing over here on the right. And as Rhonda suggested, time is of the essence. So the ability to access without having to leave her mobile device or leave the application she's in and get content discovery in the flow of work in a secure, compliant platform is really important. So the ability to aggregate, create, curate, and target, and do so over here quickly and easily, again, that meets the goals that Tobias talked about, and we'll show you a quick demo, and then we'll take some questions. So with that, I'll hand things over to Corey. Okay, Corey, you should get the control here.
Perfect, thank you, Phil. All righty. Perfect, well, thank you, everybody. I know we're limited on time, so we'll see a really brief demo, mostly to tie together some of these core concepts shared by Tobias and Rhonda and Chris, and just to highlight some of the key areas from Tobias. You know, there's no shortage of information out there or content. The problem is one of discovery of the content and how personalized that can be. If employees feel like that content is engaging and it's personalized, they have a better employee experience, they're more likely to engage. This is a great way to retain your experts and leaders within the organization. So with EdCast, we have some pretty amazing technology focused around machine learning and AI to really deliver on that concept of the Netflix of learning. And then Chris also mentioned the idea of a push versus pull. Netflix doesn't exactly assign you TV shows to watch, and we obviously would integrate with a learning management system that has your compliance and regulatory training that is pushed. But here we see more of what we call a gentle push or a personalized push based off of an employee's job role or function, different interests, areas of expertise. So here under the Home tab within EdCast, we have this content that's pushed to me daily, every 24 hours with these insights. As a member of the Enterprise Solutions Group and sales team, I see content that's focused on marketing, sales, and it's all blended. It's coming from a variety of different sources, whether it's informal or more formal content, whether it's external, or the most valuable content is the internal content that's specific to your organization, and this is where EdCast is HIPAA compliant. It's able to integrate with your internal sources and basically surface those right here under this home screen. Quickly merging over to the other tab here, we have the Discover tab. And just to speak on Tobias's point about having kind of an API-driven integration approach, this allows us to show and surface content a lot of different ways here under a Discover tab. So we have a concept of channels in EdCast based off of different topics and areas and categories, so essentially communities of practice. So for onboarding, for example, and again, this is the EdCast platform for EdCast, we have a channel called You Had Me at Hello. So new employees are encouraged to go there, record a video live stream of themselves. We have onboarding pathways that are specific to different roles. And then, that learning doesn't just stop after the onboarding, it's a continuous process. So being able to go back and re-engage with that content is really critical to driving engagement and having a consistent experience. And we've said this a few times, but Rhonda's point around the tyranny of the urgent. We need information that's actionable. We want to deliver this to employees in a moment of need, and that moment of need is critical, especially in a healthcare situation or in a hospital. So being able to surface this in the flow of work based off of job roles and functions, having internal content that's made available to you from your SharePoint or Box or other sources is key. And then also being able to integrate with these featured providers like Tobias talked about, API-driven ecosystem, so as content changes, as needs change, the experience for the employee and the user is consistent. These content providers may come and go and other systems may come and go, but from a kind of an entry point perspective or a front door to learning, EdCast can be that consistent experience. And then just to finalize things a little bit, I'll go to the Me tab. And this is where we have basically profile type functionality. So Chris spoke to this a little bit around the importance of a learning culture and being able to gamify this a bit. How do we quantify that? How do we, retain our top experts and leaders within the organization? We spend, so many resources on the talent acquisition, but how do we then engage them? How do we develop this talent? So we do this by encouraging experts to share their insights. They like to be recognized for their expertise, so we have badges, micro-certifications, and essentially different profile items here, and things that are in progress. So essentially you're able to see all of your learning activity in progress all in one place. And then you notice the search bar, so having that unified search across all of your content sources. Based off of your role, you might be allowed to create content as an expert. You might be expected to curate content. So we're bringing together all these trends into a single platform to really benefit all different levels of the organization. Someone who's new and is starting their onboarding sequence, or someone who's an expert and been with the organization for decades, and how do we capture their tacit knowledge? How do we encourage them to share those insights with new employees and again, have that consistency of information like Rhonda talked about, and having reliable best practices that are franchised out across to everybody and made available to everybody. So with that, I want to thank everybody, and we'll open it up to some questions, and I'll let Phil kick off a few questions.
Absolutely. Because we are short on time, we're going to just take one question that will go to each of our presenters. We'll start with Tobias and then Rhonda. The question is, in the area of workforce engagement and satisfaction, what are you doing to help bring about increases in workforce engagement and satisfaction to your organization, Tobias? And in the case of Rhonda and Chris, what are you doing to help your partners and customers increase their workforce engagement and satisfaction? So let's start with Tobias. Can you speak on behalf of Christus Health?
Sure, I'll do the best I can. I work alongside my peer who's over that area, but what we try to do in essence is to partner very closely and take our learnings from an engagement perspective or the results we get from an engagement perspective and tie the pathways or the learnings that we want to recommend to assist in helping our leaders become better leaders and, of course, drive stronger engagement in our ministries. That's ultimately what we try to do, is make sure that my peer and I are very partnered. He's the director of career management and engagement, so we partner to ensure that whatever we're seeing coming out of engagement data, that we are putting together the appropriate learning. And, of course, our other peer, who's the Director of Strategic Development, we help to put together what that learning would look like to support getting our leaders stronger to respond to those engagements.
That's great. That's great, Tobias. And obviously, we have worked with you. We understand that strong commitment. So that's great. Maybe, Rhonda, could you weigh in as well
Sure,
with all
sure.
of your partner organizations and hospitals that you and Viserys
Right.
work with? What are you doing? What have you seen in terms of best practices with workforce engagement and satisfaction?
Well, with any technology, the primary consideration you have is adoption by the user. And so without adoption, your investment doesn't go very far. And so what we focused on is helping customers to customize the technology solution, provide training, and which then facilitates adoption. And we know for sure, for a fact, that what drives adoption is when users find that the technology fits within the context of their work. Not specifically their workflow, although workflow is important, but it has to fit in the context of their work. It has to be useful to their work. It can't create more steps or provide more confusion. It has to be able to facilitate what they're trying to do in a more seamless fashion. And so I would say that once you've accomplished that, your investment is realized. You have folks who are more engaged in the process of selecting technology and using technology.
That's great. Very well said, Rhonda. Thank you. And Chris, to round things out, maybe from your perspective at Syneos, maybe you could address the same question.
Sure. I'll have to echo what Rhonda just said. One of the things that we really focus on when it comes to engagement is making sure that learning happens within the flow of work. And so when we provide the right kinds of learning and training content to people at the point of needs, then they have the access to the stuff exactly when they need it, and that increases their levels of engagement dramatically. If they have to wait for access to content, chances are the moment of need passes by and it either becomes irrelevant or not anywhere near as meaningful. And so when we try to situate it and rationalize it and turn it into just-in-time content, it really helps to increase the overall levels of engagement for our learners.
Excellent. We could not agree more. Chris, thank you. Very well articulated. I actually want to transition now because we've run a few minutes over. I want to thank everyone who's joined us for our webinar. This was recorded, and we will share the recording with the folks that have registered. Even more important, I want to thank each of our panelists today. I want to thank Tobias Washington from Christus Health. I want to thank Rhonda Collins from Viserys Communications. And I want to thank Chris Christensen from Syneos Health. Each of you has really contributed an amazing part to this webinar. Thanks to each of you. And with that, I am going to wrap up the recording. Corey and I appreciate everybody joining, so let me wrap this up.